Everyone remembered how special interests had sabotaged the Clinton plan.
They want to get people onto the table. They don't want this to be, at first at least, a fight against the insurers, a fight against the medical industry. They want the pharmaceutical industry. They want to get buy-in.
I'm going to switch gears and get some groups in here. And
Obama's advisors had told him that many of the lobbyists in the room were prepared to cut a deal.
IGNAGNI?
Karen IGNAGNI is the chief lobbyist for the insurance industry.
Why don't you wait for a mic, Karen, so that...
We entered this year being committed to change, being committed to restructuring, and committed to actually helping to get this done.
We hear the American people about what's not working. We've taken that very seriously. You have our commitment to play, to contribute, and to help pass health care reform this year.
Good. Thank you, Karen. That's good news. That's America's health insurance plans.
This was really astonishing. Here she was on record saying, we're going to help you, and so too were the drug companies.
Karen IGNAGNI wanted to be sure that she was at the White House representing the industry in the most positive way that she possibly could. It was part of the industry's charm offensive, as I call it. The industry knew that it was going to be under attack this year, or at least the legislation would focus very heavily on the insurance industry.
And you know, look, I mean, they could read the political tea leaves. You know, the saying in Washington was, you can be at the table or you can be on the menu.
Privately, IGNAGNI was playing hardball. She said she'd support the bill only if everyone was required to buy health insurance.
They said for the first time they would support universal coverage, with one caveat, and that is that we have an individual mandate requiring people to buy insurance, so it's not just the sick that buy insurance, but everybody. That was the quid pro quo.
Obama had campaigned against the mandate. IGNAGNI was insisting he reverse himself.
They want to make sure that they get a requirement that all of us buy health insurance. They want to make sure that we are all forced to buy products from them. And they want to make sure that there's no alternative other than the private insurance market. That's why they're so adamantly opposed to the public option.
Obama had also supported the public option, a government health plan. And IGNAGNI wanted him to walk away from that, too.
It is not wiping out the private insurance industry. It's just creating a public insurance plan that would compete with private insurers. But they wanted no part of that.